Good morning, good afternoon, good evening, everyone. Welcome back to my channel. Our topic for today is about children and mass, and brought to you by our very own Sparrow TV. We have questions that rises recently about children and mass related to coronavirus disease or COVID-19. Here are the questions. Should children wear masks? Should children with developmental disabilities should wear masks? How about children with health and medical issues should wear masks? Should a child would wear masks at home? When playing sports or doing physical activities are required to wear masks? And lastly, are there alternative public masks such as face shield? Number 1. Should children wear masks? WHO advises that always consult the local authorities on recommended practices in their area. WHO also reviewed evidence on COVID-19 disease and transmission in children and the limited available evidence on the use of masks by children. Based on this, WHO and UNICEF advise the following. Children aged 5 years and under should not be required to wear masks. This is based on the safety and overall interest of the child and the capacity to appropriately use a mask with minimal assistance. WHO and UNICEF advise that the decision to use masks for children aged to 11 should be based on the following factors. Widespread transmission in your area. Ability of child to safety and appropriate wear of masks. Accessibility of masks, schools and child care services. Adult supervision. Impact on wearing masks on learning. And lastly, specific setting and interaction of children to other people with underlying health condition. Okay, number 2. Should children with developmental disabilities should wear masks? The use of masks for children of any age with developmental disorders, disabilities, or other specific health condition should not be mandatory and be assessed on a case-by-case basis by the child's parent, guardian, educator, and or medical provider. In any case, children with severe cognitive or respiratory impairments with difficulties tolerating a mask should not be required to wear masks. Number 3. How about children with health and medical issues should wear masks? Children with underlying health conditions such as cystic fibrosis or cancer should wear a medical mask in consultation with their medical providers. A medical mask provides protection to the person wearing the mask and prevent transmission to others. It is recommended for anyone who has underlying health condition to put them at greater risk of serious illness. Number 4. Should a child would wear mask at home? Any child who has symptoms suggested of COVID-19 should wear a medical mask as long as they can tolerate it. The child should be isolated and the medical advice sought as soon as they start to feel unwell, even if symptoms are mild. Family members, caregivers who come within 1 meter of the sick child at home should also wear masks. A household member who is sick or has tested positive with a virus that causes of COVID-19 should be isolated from everyone else if possible. If the child comes within 1 meter of the sick person at home, the adult and child should wear a medical mask during that time. Number 5. When playing sports or doing physical activities, are required to wear masks? Children should not wear a mask when playing sports or doing physical activities such as running, jumping, or playing on the playground so that it doesn't compromise their breathing. When organizing these activities for children, It is important to encourage all other critical public health measures, maintaining at least 1 meter distance from others, limiting the number of children playing together, providing access to hand hygiene facilities, and encouraging their use. Number 6. Are there alternative public masks such as face shield? In the context of COVID-19, some children may not be able to wear a mask due to disabilities or a specific situation such as speech classes where the teacher needs to see their mouths. In these cases, face shield may be considered an alternative to masks, but they do not provide the equivalent protection in keeping the virus from being transmitted to others. If a decision is made to use a face shield, it should cover the entire face, wrap around the side to the face, and extend to below the chin. Caution should be taken while wearing one to avoid injuries that could break it and harm the eyes or face. Remember, knowledge is power. Thank you for watching. And also thank you for our source, which is the WHO. You can also check their website for more information about COVID-19 updates. Thank you. Please don't forget to like and subscribe my channel. Bye-bye.